Why should you as a medical educator care about virtual worlds? Thank you for joining us in the second installment of Medical Education and Virtual Worlds, a new type of learner. The term NET generation, short for Internet generation, is used to describe the generation of people who grew up during the rise of the World Wide Web. The ages of those included in this generation varies by country depending on when Internet technologies became widespread. For countries influenced by the web shortly after its development in 1991, this would be people born in the late 1980s and early 1990s. These are digital natives, computer-savvy individuals. NET generation people have no memory of a world without computers and other technologies. Computers are not only accepted. Medical educators may be able to capitalize on this familiarity to use virtual worlds in new ways to reach and teach this rising generation. Increasing demands on educators such as resident 80-hour week, clinical productivity, conflicting values and metrics are resulting in a reduced cadre of medical educators to conduct teaching, mentoring and role modeling and assessing learners. The challenges of the competency-based movement making a series of additional demands on educators, one of them increased accountability and documentation and the teaching and learning of an ever-growing number of new competencies, palliative care, geriatrics, genomics, cultural competencies which they need now to meet and assess. In addition, there are also patient shortages that impact trainees' education and training due to the fact that we have to deal with increasingly sicker patients who are discharged quicker. Less time to teach in outpatient settings due to the pressures on clinician educators to see more patients. Increasing regulations on patient confidentiality that make it more difficult for trainees to access records and talk to patients. Plainly, not just enough patients in the acute care setting, reduced number of beds with increased turnover. Increasing competition for teaching and training time with other medical learners, residents, fellows, medical students, and also nurse practitioners, PA students and other ancillary health professions. Virtual worlds may provide simulation alternatives to some of these problems. A very important challenge is that in some areas, training and the development of competencies is just not occurring or occurring on a very limited basis, in part due to all these challenges, but also because we do not have the resources, technology and settings to teach them and implement their curriculums adequately. Examples are team training skills, disaster management, dealing with transitions of care, health disparities and cultural competencies, NIP and communication skills.